As we know, the topic we're discussing today is community-based approaches to maternal and child health. Maybe to members out there, most of the time we are making a lot of noise about the government or the state's investment in hospitals, in health facilities. But we need to remember that health facilities only offer 20% of the health care. The remaining 80% is offered in the community. So as we also strive to find solutions to deal with maternal and child health in the health facilities, our clients come from communities where 80% of the problems and the care should be, and also 80% of the investment should be. Of course, the government has been investing highly, but I am proud to listen in on this CME. Our presenter this evening is Toeposta Agutu. Toeposta Agutu is a communications and public health professional and has a lot of experience in communication programming. She has passion for maternal and child health issues, and currently she's serving as the communications and networking director at Save the Mothers East Africa. She's also a lecturer on the Master of Public Health program in leadership at the Uganda Christian University, and I would urge members to welcome her. Dr. Toeposta, please, you're welcome to address us, and we shall learn from you.
Thank you so much, Dr. Musana. Good evening, everyone. My name is Toeposta Agutu once again. On behalf of Save the Mothers, we are very, very privileged to be here this evening to speak and discuss a community-based approaches to maternal and child health. I bring you very warm greetings from Save the Mothers East Africa at Uganda Christian University, the Center of Excellency in the heart of Africa. Save the Mothers is a non-government organization which says in its vision, in our vision as Save the Mothers, no mother or child should die due to preventable or treatable childbirth-related complications. So we are in line with what Busoga Health Forum stands for. So we are privileged to be here and to share with you what we have as Save the Mothers. I will start to share my screen shortly and swing into the presentation. So there is what we are sharing this evening, community-based approaches to maternal and child health, as Dr. Musana pointed out right. 20% of the health issues that we deal with can only be handled at the health facility. So us who are not health professionals, we need to know that the community is rich, the community is a great resource that we need to tap into, that we need to work with. I'd like to acknowledge the contribution from Save the Mothers team here, Dr. Mushini Subuga, the Executive Director of Save the Mothers East Africa, Josephine Namialo, Academic Coordinator, Master of Public Health Leadership, Save the Mothers East Africa at Uganda Christian University, and Master of Public Health Leadership alumni, the game changers, who have great information that they've been sharing with us that we have documented as Save the Mothers that we will have a chance to share today with Busoga Health Forum audience this evening. The presentation outline will look very quickly into the principles of community-based approaches to maternal and child health, MCH. And we will look at Save the Mother's approach through the Master of Public Health Leadership and what Save the Mothers does through the community-based projects by the Master of Public Health Leadership alumni, a very big network that we pride in. Very quickly, I'll go through the community-based approaches as approaches that engage and involve local communities to improve health outcomes for mothers and children. We need to gather communities on board, and we need to leverage the local resources within the communities, the knowledge, and their meaningful participation to address health challenges effectively. Because the communities know what is within them, and we must be able to tap into them in a very meaningful manner. Community engagements, as let me just go through some of the key elements of the community-based approaches, like community engagement and participation, where we need to gather communities and engage them meaningfully in the processes of planning, decision-making, and implementation of interventions within the communities, such that we are informed by what is within the communities to make the interventions that will speak directly and influence change within the communities. Health education and awareness, we need to do this in order to address myths and misconceptions that might be in the communities regarding maternal and child health. We know our cultures, we know our socialization, and sometimes, a lot of times, it gets into the way for the positive maternal and child health indicators. So we can do this through promotional materials. We can do this through different channels. Utilize local media, drama, and community meetings such that we engage and have dialogue and discussions with the community. Build the capacities of the community health workers such that they are able to provide basic health care, health education, and referrals where a community health worker is within the community and meets a mother, interfaces with a mother who has danger signs during pregnancy. They should be able to encourage this mother to get to the health facility such that she is attended to by skilled professionals. Access to healthcare services is another element for community-based approaches. We need to work towards having community-based clinics or mobile health clinics, where we are able to take services to the communities, closer to the communities, within the communities. And this helps us a lot to address those populations, those community members who may not be coming to the communities, to the health facilities rather. So that way, we are able to take immunization, antenatal care services to the communities. Home visits and outreaches, we need to look at the community, but also look at the homes, where the community health workers and the health promotions professionals conduct home visits to provide care and monitor health and give guidance on health practices to guide the community members, the home, the women, the children, the families, to be able to adopt the right health desired practices. We also need to do the outreaches specifically to remote and hard to reach populations, like mountainous areas. These sometimes miss out. So with home visits and such outreaches, then they can access postnatal care, especially those who would probably have delivered are at home and they don't see any danger signs, so they feel, I am well, my child is well. But when the community health workers and the health professionals reach out to them through these home visits and the outreaches, they may be able to touch some issues that need professional care and save lives. Community mobilization, here's where we look at advocating for better health services and infrastructure. What is in our health facilities? What can we do as communities to speak out in one voice and advocate and lobby for better health services? Is it a health facility that is meant to have an operating theater? Does it have it? So we need to have the information that we can share with the communities, community members, and empower them such that we move together and advocate for better services and infrastructure, other health facilities. Probably women who are coming for antenatal care need shelter. Are we able to come up and rally with these communities and help them appreciate that we can work together and advocate for this? And community mobilization really emphasizes that information is power. We use what is in the health facilities, the information that is available, to help the communities appreciate the gaps and the challenges that can be actually addressed. We need to involve our community leaders and local organizations within the communities and religious institutions to promote health practices. We know that the religious leaders are respected in the communities. When they speak using the pulpit, they are respected and the message goes far and wide. So community mobilization is another key element that we look at and say that for community-based approaches, that is very important. Monitoring and evaluation, where we need to assess the effectiveness of the community-based interventions through data that is collected and analyzed. What is the data at the health facility telling us? Is it telling us that many women have malaria in the communities and yet they have the mosquito nets? What can we possibly do and make a contribution with that data that is very informative, where we are sharing the outcomes of the health interventions and bring them into the community. And that way, the communities can make very informed decisions after thinking critically. And we keep the conversation going regarding the gaps that the data is showing, or the good news that the data is showing, where they could be saying, now women are delivering at health facilities more than before. And so we are able to use this feedback to improve and adapt our programs accordingly as we replan and make better interventions that are informed by research. Partnerships and collaborations are very key. Who are the NGO partners? The government, we can't run away from the government because we are also the government, international agencies, and local businesses. How do we work together? How do we engage them in these partnerships, in resource mobilization, to speak with one voice on issues of maternal and child health? And we must do these things in a very culturally sensitive manner, where we respect and integrate local beliefs, traditions, and practices in health interventions. Where they are good practices, they may be local to us, but if they are not harmful, we need to respect these. And if they are harmful, we need to identify the leaders in the communities who will speak, and the community members will listen to them. You and I may not be the right persons, but within those communities, there are particular leaders who can pass on this message in a culturally sensitive manner. For example, when you talk about circumcision in Bugisu, we know that in the times of HIV, there were issues being raised, concerns about the circumcision tools being shared, but the cultural leaders were involved and they were able to speak to the communities so that everybody who is being circumcised has their own tool. That is being very culturally sensitive, such that our message, our intervention is appreciated for continuity and sustainability. So we are working with the local healers and traditional leaders to align health messages with cultural norms. And when we think about the cultural norms, we can look from central, east, west in this country, in the nation, and the region as a whole. And we know that there are particular cultural norms that you know that however much you think that you're the best health profession, you cannot run away from working with the local healers and traditional leaders. We need them on board because they are listened to. Sustainability is another key element of community-based approach. We need interventions that are affordable, that can be scaled, that are sustainable in the long term, such that if you are implementing something in a certain community, what are the structures within that community that you need to work with such that even when you're long gone, this intervention can stay. It will stand the test of time and it can be replicated in other communities. We need to build community ownership and capacity for continuity. Because there's participation in the community engagements, we will be able to identify those gaps, those areas that need capacity building, those institutions that need capacity building within the community, such that we are moving with the communities, and when we are long gone, the communities will continue and they will appreciate that this is their own because we have involved them in all the processes for maternal and child health, where they have identified the gaps and also identified solutions together with us. Okay, those are the key elements of community-based approaches, just as a recap for us. Now, I'd like us to look at Save the Mothers approach to community-based interventions through the massive public health leadership program. Save the Mothers, in partnership with Uganda Christian University, offers the massive public health leadership for multidisciplinary professionals. And these are professionals who have done their first degree, completed it, their first degree in any field. So these professionals are equipped with public health knowledge and skill, such as community-based approaches and safe motherhood knowledge that helps them to start appreciating and understanding issues of maternal and child health. Some of our alumni have said, when they got onto the program, it was like they were wearing different lenses in relation to looking at maternal and child health issues. They are able, because they are equipped with this knowledge and skills, they are able to identify safe motherhood challenges in their communities, in their workspaces, and implement change projects to address the challenges using their various spheres of influence if they are lawyers, if they are teachers, if they are journalists, if they are medical doctors, whatever they are, they use that and move, because it is a program that looks at multidisciplinary professionals. When it comes to issues of mothers and children, maternal and child health, we know that the doctors, the health professionals cannot work alone. So I'd like us to look at that network of the Save the Mothers multidisciplinary professionals. And we have over 500 multidisciplinary professionals who have gone through the Masters of Public Health Leadership Program, implementing change projects at different levels within their own capacities and their resources. Yes. So allow me now to swing into the Save the Mothers game changers who have been inspired to change their communities through innovative leadership to reach the last mile mother. We like to call them the game changers, as displayed in that picture, which has documented some of the very few stories of the Save the Mothers Mass of Public Health Leadership alumni stories of change in the area of maternal and child health. I would like you to meet the one chicken per household intervention that is implemented in northern Uganda in Oyam district by our alumni, Peter Olet. Peter Olet is a hospital administrator at Timaji Community Medical Center, which is a private not-for-profit public health facility. Peter Olet has been on the Master of Public Health Leadership Program. And when he went back into his workspace, he started looking at issues of maternal and child health a little differently. He started thinking about the mothers who die in the community and thought very thoroughly and said, what do we have in this community? What do we have? What do I have in my hands to make a difference? He said, he has the skill, he has the knowledge gained on the Master of Public Health Leadership Program. So through the approaches and the principles of community-based intervention, he engaged his community and said, what are our biggest problems? Our mothers are dying. We have this health facility here, but a lot of times when we refer them, where we are referring them to is very far away. And sometimes we lose our mothers because of the second delay. And this happens after referral. Or sometimes wherever they are coming from, they come into the health facility when it is too late. So through those community meetings, community engagements, Peter Olet came up with the one chicken per household intervention to raise funds using the local communities, what is within the local communities, for maternal and child health at Timaji Community Medical Center. In the picture there is Peter in his community in Oyam, where he works. He goes to the communities because he knows that there is power in the communities. And when the communities know us, even when we are at the health facilities, they feel more confident to come. So this one chicken per household intervention was implemented, is being implemented, is still continued. Using community meetings, in that picture, we see a community meeting in progress under a mango tree, and that is in Peter's community. And one of the concerns they had is like, we need to expand our health facility and bring on board a structure that will house a maternity ward and theater, such that we end this issue of these referrals to long distances. So in his own words, Peter says, so when the communities proposed that and they agreed, then there was a question, how are we going to raise the money? How? They had no answers. They tried to write proposals, but nothing came through. Then one day, he said, but what, Peter said, what do we have in this community? He said, in every homestead, in every household, there is chicken. Let's use chicken. When he told the community leaders that we are going to use chicken, they asked him how. He said, let's mobilize our communities. Let them bring the chicken, and we will sell the chicken, and we will start raising our structure for the maternity ward and theater. It was like a dream too far. It looked very impossible. They started very slowly. Some people contributed building materials, but the biggest thing was chicken. That chicken has done wonders. That structure that we see here is now where they are looking to say, we have moved this far. And they started slowly. They have roofed it. When Save the Mothers followed up Peter last year, that building was not roofed. And we kept on saying, so Peter, where are you going to find them? And he says, chicken. And here is chicken. It is one chicken, many households. And with the chicken and other resources that the communities have contributed, including labor from the communities, they have been able to raise over 74 million shillings locally within their own community. That structure is up, and that is a very, very big challenge to us who look and say, where is government? We are a government. We are the government. So that is the one chicken per household intervention in Oyam district. Then I move us into the Elgon region in Mbale, where we have an organization called Mother's Heart, initiated by Jeremiah Bulamani, who is a graduate on the MPHL Master of Public Health Leadership Program. He was on class 2012. The Mother's Heart was birthed in response to Jeremiah's Master of Public Health Leadership research, his thesis, where he was looking at the communities and what could be the stumbling block for the communities to access health services. These are mountainous areas, hard to reach, in a village called Mutoto in Mbale, the home of circumcision in Mbale. From this thesis, the recommendations were to improve literacy levels and end poverty. When Jeremiah completed his thesis, passed, he went to disseminate the findings to his community in Mototo, Mbale. When he finished to share the information, and he bid the community farewell, the community asked him, "So what brought you?" He said, "For me, I finished my master's. I just came to share this information. It's a requirement. Otherwise, I am going back to my workspace and continue with my work. I'm a journalist and I'm going back." And they told him, "So why did you share this information?" They were perplexed as a community. He told them, "I don't have anything to do with you. I have finished my part. Bye-bye." He went away. Jeremiah went away. But the community members, leaders, followed him up and told him, "You need to do something. You said there's low literacy. You need to end poverty. So what do you want us to do? You're the one who is learned. You've gone to school. You're telling us now you have a master's. Do something about it." But Jeremiah thought, "For me, what can I do?" But the rest is history. Today, Jeremiah went back to that community and worked with the community and initiated and started a school. And the Amango Tree then made some structures that were temporary. They moved in. But the school today, Golden Junior School, is in place. The community, Mutoto, at that time did not have a school. Today, that community has a school. And it is helping many young people to stay in school. And we know that school is one of the protective factors when it comes to issues of health. We know that our girls would delay to start sex. They would delay to get married if they are in school. So Jeremiah started that. It was a ramshackle building. Today he has permanent structures in that community. The community is very happy. Their children move very near within the community to access education. And in here, that picture where the children are in blue uniform, those are the learners of primary 7, class 2023, who are just getting ready to do their exams. Today, 2024, they are in secondary. Think about a community. If that school wasn't there, what would have happened to these young men? There are 2 boys there, and there are 6 girls. What could have happened? If you come from a rural community, raised in a rural community like me, you know what could have happened to those girls. They could have dropped out of school. Those boys probably would not be in school anymore. They are in secondary school. And definitely starting that school was not an easy job, an easy task. A lot of construction was done by community members to set up that school. Jeremiah also has a community empowerment program because he needed to address the poverty issues. In that program, the community members, especially women, are skilled in various areas: hairdressing, craft and tailoring, and thereafter, Mother's Heart Uganda markets their products. Here, where we see 3 ladies, they are learning how to plait hair. And when they do the hairdressing and master it, Jeremiah has set up a salon in Mbale where they can go and do more work. Mutoto village in Mbale. Terrain is not very good. Many mothers used to get into labor. They get into labor, and labor that comes at night, where there's no any means of transport. Mothers lose lives. Babies die because they cannot access a health facility. Jeremiah was very proud to announce that now Mutoto village has a tricycle ambulance within its community at Mother's Heart, Uganda, where they are able to serve over 10 mothers to take them to a health facility, because that ambulance is now in place. And he gets support from the communities. Before he got that ambulance, he had a car that he used to take mothers to the hospital. And sometimes the midwives who don't know him will tell him, Mbale Regional Hospital, Jeremiah, how many wives do you have? You just brought another woman the other time to deliver. Again, you've come back, because they didn't know that he was simply serving his community, and that is service beyond self. On the right, we have a picture of Jeremiah speaking to his community after having distributed mosquito nets. He's emphasizing prevention of malaria, and especially during pregnancy, and also for the little ones. So here we see the approaches of community-based interventions in the work of our Master of Public Health Leadership alumni. That is Jeremiah's story at Mother's Heart, Uganda. He has also been able to partner with other organizations, collaborate, to see that the school is powered up with solar, and that is a connection he's had by working with other alumni and other partners in his community, in his region, and beyond. So the power of collaboration and partnerships is laced in all these interventions. That is Jeremiah. In the Mutoto community, now we get to Bunyoro Kitara region, where we meet Andrew Collier, who has also done the Master of Public Health Leadership Program. He is based in Kagadi district. Andrew implements a maternity basket fund where he uses community groups that are already in place, and he shares with them issues of maternal and child health. He finds them saving maybe 1,000 or 500, then he Save the Mothers also works with influential leaders through our alumni. There we see on the right in that picture is Reverend Susan Olua, who has been on this program. She did this program in 2005. Susan is married to Bishop Alfred Olua. Susan keeps on saying every time she would finish her class, she will go back home and share some information with her husband, Reverend Olua. And Reverend Bishop Olua would be very interested. At that time, he was a reverend, now he's a bishop. He would be interested. What Susan did not realize, that the bishop had taken this very far, using the pulpit to raise awareness and health education on maternal and child health. So Susan says, I always get surprised when Bishop spells out the birth preparedness plans and the importance of family planning to his folk. She thought she was simply talking, but there's a ripple effect of what she used to tell her husband. And now Bishop always says in an interview with us, when we're following up our alumni, Reverend Susan, Bishop always says, almost all the information I share on self-motherhood, I got it from my wife, Reverend Susan, who is my self-motherhood encyclopedia. And the people in Lango know that where Bishop Olwa is, and they are women, he will pick them out, speak to them, and give them a message on maternal and child health. It has become part of his brand because of Reverend Susan, who has gone through the program. Yes, in Busoga region, we have our alumni too, many of them, Medi Mukalu, who uses Borders. He has partnered with the border groups to raise awareness on maternal and child health. He has trained them through his Communities for Childbirth International organization, which he heads. They address the second delay, and Medi says, a border rider, the moment he gets you, he has conversation. So if he's powered up with maternal and child health information like these 120 borders, they'll pass on the information, they are passing on the information. These are the structures within the communities that we need to work with. We need to identify and build the capacities. These borders capacities is built in the issues of maternal and child health, and Medi works with many partners. He collaborates with the Busoga Kingdom, among others, as he shares. And of course, lastly, coming to the conclusion, Busoga Health Forum. As Serve the Mothers, we are proud to be associated with Busoga Health Forum because the CEO of Busoga Health Forum, Moses Changwa, has gone through the Masters of Public Health Leadership. And in his own words, he says, Save the Mothers program has equipped many of us from this region to cause change in so many areas of maternal and child health. So going through the Masters of Public Health Leadership program has inspired many of our graduates who are doing great work. These are just some of them that we have shared today. But there are a lot more. And there in that picture, Save the Mothers had followed up Moses Changwa in his office to see what he is doing. So he shared his work, and the work of our alumni keep us surprised, very engaged, and very impressed, and a lot of times very surprised because of the innovation that is displayed, showing the key principles, the key elements of the community-based approaches to maternal and child health. It shows us that we need to work in collaboration, in partnerships, and appreciate the communities as they are. And with these kind of interventions, there is continuity, there is sustainability beyond what we as Save the Mothers ever imagined. Indeed, no mother or child should die due to preventable or treatable childbirth complications. And on the last slide, I just want to say that at the moment, Save the Mothers, in partnership with Uganda Christian University, we are now receiving applications for the Masters of Public Health Leadership Program for the September intake and January intake. A multidisciplinary approach which engages multidisciplinary professionals. As we have seen, skilled, driven, self-driven, passionate about maternal and child health interventions in their communities, is a program that is a 2 years program. It has two semesters a year. It's an online program, 70% of the time, 30% on site. Applications are online. For further information, you can contact us through Josephine Namialo over there. Thank you so much for listening to us this evening. We have been very privileged. Over to you, Dr. Musana.
Dr. Musana.
Thank you very much, Toeposta. Yes, I'm back. So thank you very much, Toeposta, for that talk. And I would like members again to understand where we came from. We said 20% of health problems are managed in the facility. And the biggest investment in healthcare should actually be within the community. And I think you've seen the testimonies of the members, all the people who have been through the MPH, focusing purposefully on leadership and how they have taken leadership roles in their community. I've seen some of the stories like one chicken per home. And those interventions, when linked together with the MCH, can actually deliver a lot of reductions in maternal and child health problems that we may see in facilities. So I'd like to welcome members. If you have some questions, you can please raise your hands. If not, many of the comments coming in are mainly, I think, comments to Toeposta. That one is thank you for the informative presentation. That's from Ndiomujenyi. Two, of course, Sylvia Namono also sends her comments. Alex Afeti, interesting scenarios, but needs a community that has a positive attitude. But I also like the presentation that the person who went to the community in Mbale gave, and the community asked him, the journalist, that please now hustle what? So together they work together for a solution. Peter Olet, I think, is one of the members of the MPA alumni who says there's need power in community mobilization. He's the one of, I think, a chicken per household. And many of the comments are mainly about thinking about the presentation, but also, I think, appreciating the testimonies that have been given. Now, Juma, Kakaire Juma from Pugweri, social worker, says mental health is also key in health, but in the MPH of leadership, this is less emphasized. How is the issue going to be addressed so that since young mothers are not emotional, I am not emotionally supported most of the time? Others are asking for sharing the presentation. Maybe you can begin with that. Does the MPH leadership actually focus also on mental health of many of these mothers? Since you said the students or the trainees tend to be from a large variety of professions.
Thank you so much, Dr. Musana. Yes, the mass of public health leadership, as in any other public health course, focuses with very special interest on the mental health as a very big component on the course. Because when we look at maternal and child health, when we look at the psychological issues that the mothers go through during birth and after, we cannot ignore mental health. And a lot of our students have done research in that area. So it is a very big component to this mass of public health leadership program. Thank you.
Thank you very much. Okay, CPD link, please, not the link for registration.
The CPD link is shared in the chat.
The CPD link is shared. I think most of the members here are actually pleased with the testimonies that you have given about your MPH leadership. Personally, as a person who deals in public health, I think community health. So there is community health, and then there is community-based initiatives. So I think many of the members on the MPH have taken a lot of issues around community-based leadership, and this is showing the fruits. But also importantly is to encourage members, please, 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 a bachelor's in any field, please join the program. It will leave you a changed person. So please continue. Juma Kakaire, thanks for the great work, Mr. Toeposta. There's a link for the applications to the UCU program. Please look at it and apply. If you have any questions, please raise your hand. If not, I think I would like to move back to Benjamin to carry this on from there. Thank you.
Perfect. Thank you so much, Dr. Musana, and thank you, Toeposta, for this wonderful presentation. I'm humbled and I'm glad to have worked with most of the people you've talked about in this presentation. They are really doing good work in this region. And I will not go into much. I request all members who are on call, all professions who are on call, kindly use the registration link I sent and register your attendance. I'll be glad to see you as people who attended this call. At this time, let me call on Dr. Mukembo, who is also part of the CPD Committee of Soga Forum, to give closing remarks. Thank you. Oh, he has given his approach, and let me just hand it over to the CEO, Mr. Moses Changwa, who is already acknowledging the presentation to give the closing remarks. Thank you.
Yeah, thank you so much, Benjamin. And thank you, Dr. Musana and Toeposta, for keeping the flag high for Save the Mothers program. We want also to say that the contributions from Save the Mothers have made a number of associated organizations, including Soga Health Forum, and we are very proud that many of us are challenged. When we come to the course, we change the thinking, we stop the blame games, and then we put hands into action. The course trains people to really focus on activities that can save a mother, and the biggest important thing here is the leadership. The leadership of that midwife, leadership of that in charge, leadership of the management committee, that makes a big impact. So we want to thank you so much, Save the Mothers, and whoever has attended this important meeting to keep attending, because BHF is there to provide you the opportunities to learn. And Save the Mothers, we want to promise that we have so many slots. You can always come back to present to us. And we want to invite whoever is in charge of any responsibility in this country to come and join this course. It's an important course that we all want to join. So for the members who are working with us, we want to encourage you that you become members of the Soga Health Forum as well, as then we do run the show as we work together to save the mothers. So I want to thank you so much, Toeposta, today. And on behalf of the forum, we want to give you this certificate of appreciation, which has been signed by our board chair, Professor Peter, and we want you to receive it and maybe pin it in the Save the Mothers office there where you sit, so that you keep enjoying the products of your sweat that the Soga Health Forum puts on the table. Thank you so much, Toeposta, for accepting. And to Dr. Musana, Busoga is always proud of you and the entire fraternity of health workers. We appreciate you for humbling yourself to always be there for the forum and chairing these important meetings. And we award you this important certificate. We encourage that we keep engaging, support our communities, because we know without you, without the others, the mothers won't be saved. Thank you so much, and want to wish you
Perfect. Thank you so much, CEO. Toeposta, do you want to say a last word before we close the session? Toeposta, we can't hear you.
Thank you so much. We are very privileged. Thank you for the certificate. I will definitely pin it up in our office that serve the mothers at Mirembe Hall at Uganda Christian University. Thank you for giving us an opportunity to present at this forum, Busoga Health Forum. Thank you. And thank you everyone for coming through. We very much appreciate. Good evening.
Thank you so much, members. And we invite you next Friday to come and present to us. Dr. Musana, I'm soon sending you an invitation. In October, we are talking about PPH. By the Ministry of Health, we shall be hosting the sessions. So I'll invite you as one of the presenters in October. Thank you so much.
Thank you.